Imagine this. You're sitting at the dinner table, or maybe you're at work, or just relaxing on the couch, and suddenly one side of your face feels a little strange, your arm feels weak for a moment, or your words come out slightly slurred. And then, just as quickly as it appeared, it's gone. Within a few minutes, you feel completely normal again. No pain, no lasting weakness, nothing. Most people in that exact moment breathe a sigh of relief and say, "It's fine, it already passed, it was probably nothing." But what if I told you that this exact moment, this brief and vanishing sign, could be the single most important warning your body will ever give you before a major stroke? Please stay with me until the very end of this video, because what you're about to learn could genuinely save your life or the life of someone you love. This particular warning sign has a name in the medical world. Doctors call it a TIA, which stands for transient ischemic attack, but most people simply refer to it as a mini-stroke. The word transient is the key here, because it means something that passes quickly and doesn't stay. And that's exactly the trap. Because it disappears so fast, most people convince themselves it was nothing serious. Maybe they were just tired, maybe they slept in a strange position, maybe it was just stress. But a TIA is not nothing. It is the brain's way of sending out an emergency flare, warning that something has temporarily blocked blood flow to a part of the brain, and if it's ignored, a much larger and more permanent stroke could follow, sometimes within hours, sometimes within days. Let's slow down and really understand what happens during a TIA. Our brain depends on a constant, uninterrupted supply of blood to function properly. That blood carries oxygen and nutrients that brain cells need every single second. When a small clot temporarily blocks a blood vessel supplying part of the brain, the cells in that area are suddenly starved of oxygen. This causes a sudden, noticeable symptom, weakness, numbness, slurred speech, vision changes, depending on which part of the brain is affected. But because the blockage is temporary and often resolves on its own within a few minutes, blood flow returns, and the symptom disappears just as suddenly as it came. The brain tissue, in this case, usually doesn't suffer permanent damage, which is exactly why the person feels fine again so quickly. But here's the critical part. The underlying problem that caused that temporary blockage, whether it's a clot forming somewhere in the body, a narrowed artery, or an irregular heart rhythm, that problem hasn't gone anywhere. It's still there, and it can strike again, this time without warning, and this time it might not resolve on its own. This is why doctors often describe a TIA as nature's warning shot. It's almost like your body giving you a preview of what a full stroke would feel like, but then pulling back just before the real damage happens. And it's giving you this preview specifically so you have a chance to act before the actual event occurs. Sadly, because the symptoms vanish so quickly, a huge number of people simply brush it off, tell themselves it was nothing, and never mention it to a doctor at all. Studies have shown that a significant percentage of people who go on to suffer a major, disabling stroke had actually experienced one or more TIAs in the days, weeks, or even hours beforehand, but never sought medical attention because the earlier symptoms disappeared so fast. So now let's talk about exactly what to watch for, because recognizing these signs quickly can make all the difference. The first and most well-known sign is sudden weakness or numbness, usually on just one side of the body. This might show up as one side of the face drooping slightly, one arm feeling heavy or weak, or one leg suddenly feeling unsteady. The key detail here is that it's usually one-sided, not both sides at once, and it comes on suddenly rather than gradually. The second sign is sudden difficulty speaking or understanding speech. This might mean words come out slurred, or the person struggles to find the right words, or they have trouble understanding what someone else is saying to them, even though moments earlier the conversation was completely normal. The third sign is sudden vision problems, which can affect one eye or both eyes. This might feel like a curtain coming down over part of the vision, sudden blurriness, or even brief, temporary blindness in one eye that then resolves. The fourth sign is sudden dizziness, loss of balance, or difficulty walking. This is sometimes mistaken for simply feeling lightheaded or standing up too fast, But when it comes on suddenly and combines with any of the other symptoms, it deserves serious attention. The fifth sign is a sudden, severe headache with no obvious cause, something that feels completely different from any headache the person has had before. And the sixth and often overlooked sign is sudden confusion, a brief moment where someone seems disoriented, unable to follow a conversation, or unsure of where they are, even for just a minute or two. Now here is the single most important thing to understand about all of these signs. Even if they last only a minute, even if they completely disappear before you've even had time to process what happened, they should never, ever be ignored. There is actually a simple method that doctors and health organizations around the world recommend to help people remember these signs quickly, especially in a stressful, confusing moment. It's called the FAST method. F stands for face, checking if one side of the face is drooping when the person tries to smile. A stands for arms, checking if one arm drifts downward when both arms are raised. S stands for speech, checking if speech sounds slurred or strange. And T stands for time, meaning that if any of these signs are present, even briefly, it's time to call emergency medical services immediately, not to wait and see if it passes. This brings us to perhaps the most important message of this entire video. If you or someone near you experiences any of these signs, even if they go away completely within a few minutes, the right response is not to relax and assume everything is fine. The right response is to seek emergency medical attention immediately. Doctors need to evaluate what caused that temporary blockage, because identifying and treating the underlying cause is often the only thing standing between that person and a future major stroke. This could involve blood tests, brain imaging, heart monitoring, or checking the arteries in the neck for narrowing. Whatever the specific cause turns out to be, catching it early and starting appropriate treatment can dramatically reduce the risk of a much more serious event happening later. Let's take a moment to talk about why this particular danger flies under the radar so often. Unlike a heart attack, where chest pain tends to linger and clearly signals that something is wrong, a TIA is almost designed to be dismissed. It frightens you for a moment, and then it vanishes, leaving you standing there feeling completely normal, wondering if you imagined it. Family members who witness it happen to a loved one often feel relieved once the symptom passes, and understandably so, since the person seems fine again within minutes. But this exact pattern, the quick resolution, the return to normalcy, is precisely what makes this warning sign so dangerous. It creates a false sense of security at the exact moment when action is needed most. Think about it this way. If a smoke detector in your house went off for 30 seconds and then stopped on its own, would you assume there was no fire and go back to sleep? Or would you still want to check what triggered it just to be safe? TIA works exactly the same way. The alarm sounded, and then it stopped, but that doesn't mean the underlying risk has disappeared. It simply means you were given a small window of time to check what's wrong before something much bigger happens. Now, who exactly needs to be paying the closest attention to this? While a TIA can technically happen to anyone, certain factors do raise the risk significantly. People with high blood pressure, diabetes, high cholesterol, irregular heart rhythms, or a family history of stroke are at increased risk. Smoking, being overweight, and living a largely sedentary lifestyle also contribute to higher risk. And naturally, risk tends to increase with age, which is why this information is especially important for older adults and for the families who care for them. But it's worth remembering that TIAs have also been known to occur in younger people, so this isn't a warning that only applies to one age group. Anyone, at any age who experiences these sudden, one-sided symptoms should take them seriously. Here's something else worth mentioning, because it matters just as much as recognizing the signs. Many people, especially older adults, hesitate to seek help because they don't want to make a big deal out of nothing, or they worry about being a burden, or they simply convince themselves that since the symptom went away, there's no real emergency. This kind of thinking, while completely understandable and human, can unfortunately cost precious time in a situation where time truly matters most. If you are ever unsure whether what you experienced was serious enough to act on, the safest choice is always to treat it as an emergency and let medical professionals make that determination, rather than deciding on your own that it wasn't important enough to mention. It's also worth talking to your family about this, especially if you have older parents, grandparents, or relatives living alone. Many TIAs happen when a person is by themselves, and because the symptoms resolve so quickly, they may never even mention it to anyone afterward, simply because by the time they see a family member again, they've already forgotten how strange that brief moment felt. Having an open conversation about these warning signs, so that everyone in the family knows exactly what to watch for and how urgently to respond, could make an enormous difference if this situation were ever to occur. Let's also talk briefly about what typically happens after someone experiences a TIA and seeks help promptly. Doctors will usually run a series of tests to understand what caused the temporary blockage. This might include imaging of the brain to rule out any actual damage, imaging of the blood vessels in the neck to check for narrowing or blockages, an evaluation of heart rhythm to check for irregularities that could cause clots to form, and blood tests to check cholesterol levels and blood sugar. Based on what's found, treatment could involve medication to manage blood pressure, cholesterol, or blood thinning, lifestyle adjustments around diet and physical activity, or in some cases, a procedure to address a significant blockage in an artery. The goal of all of this is simple: to reduce the chances of a major stroke happening in the future by addressing the root cause early, while there's still time to do something about it. It's important to understand that a TIA is not something to be afraid of in the sense of feeling helpless. Quite the opposite, it's actually one of the most useful warnings the body can give, precisely because it offers a chance to prevent something far worse. The real danger lies only in ignoring it. Someone who takes quick action after a TIA has a real opportunity to change their future health outcome entirely, simply by getting the right evaluation and treatment before a major stroke has the chance to occur. There's another layer to this that deserves real attention, and that's how easily this warning sign gets rationalized away in the moment it actually happens. When someone's arm suddenly feels weak or their speech briefly slurs, the brain's first instinct is often to search for a harmless explanation. Maybe they slept awkwardly on that arm. Maybe they were just tired and tripped over their words. Maybe it was low blood sugar, or stress, or simply standing up too fast. This instinct to explain away a frightening symptom is completely natural, but it's also exactly what allows a TIA to slip past unnoticed. The mind wants an easy answer, and the fact that the symptom vanishes so quickly makes that easy answer feel believable. But the speed at which it disappears isn't proof that it was harmless. If anything, it's the opposite. It's proof that something significant happened in the blood flow to the brain, even if only for a few minutes. It also helps to understand why this particular warning sign is so often missed by the people around the person experiencing it, not just the person themselves. Picture a family gathered at the dinner table. Someone briefly struggles to get a sentence out, maybe repeats a word oddly, and then a moment later continues the conversation completely normally. In the middle of a busy, noisy family dinner, this can be incredibly easy to miss entirely, or to notice and quickly forget about once the conversation moves on and nothing seems wrong anymore. This is exactly why awareness matters so much here, because unlike a heart attack, where the person is often clearly and visibly unwell, a TIA can pass by almost invisibly in an ordinary moment, unless the people around that person know precisely what small signs to watch for. There's also an important psychological piece to this worth mentioning. Many people who experience a TIA describe a strange sense of denial immediately afterward, almost an instinct to convince themselves and everyone around them that nothing happened at all. This isn't dishonesty, it's simply how the mind tends to respond to something frightening that resolved quickly. The problem is that this instinct to minimize what happened can directly interfere with the urgency needed to seek help. This is precisely why it helps enormously to have this knowledge in advance, before it's ever needed, so that in the moment it happens, there's already a clear understanding that quick resolution does not equal low risk. Something else worth touching on is the timeline involved here. Research has consistently shown that the period immediately following a TIA carries a notably elevated risk of a full stroke occurring, and this elevated risk is highest in the first hours and days afterward. This is very different from many other health warning signs, where there might be weeks or months to act. With a TIA, the window for meaningful intervention can be remarkably short, which is exactly why immediate action, rather than a wait-and-see approach, makes such a significant difference in outcomes. Waiting even a day or two to mention it to a doctor, thinking it can be discussed at the next regular appointment, can mean missing the exact window when preventive treatment would have been most effective. It's also worth considering how this knowledge can be shared in a practical, everyday way within a family. It doesn't need to be a formal, serious conversation held only once. It can simply come up naturally, mentioning to an elderly parent or a spouse that if they ever notice one side of their face feeling strange, or their arms suddenly feeling weak, or their words coming out oddly, even for just a moment, the right move is to call for emergency help immediately rather than waiting to see if it passes. Repeating this kind of information casually, more than once, in different conversations over time, tends to make it far more likely that someone will actually remember and act on it in the rare, stressful moment when it's actually needed. To bring this all together, if you ever notice a sudden drooping on one side of the face, weakness in an arm or leg, slurred or confused speech, sudden vision changes, dizziness, or an unusual, severe headache, even if it lasts only a minute or two and then completely disappears, do not wait, do not assume it was nothing, and do not simply move on with your day. Treat it as the emergency it truly is and seek medical attention immediately. This one decision, made in a moment that might otherwise be dismissed as unimportant, could be the very thing that prevents a life-changing stroke down the road. All the information shared in this video is meant purely for awareness, so that you and your loved ones know exactly what to watch for and how urgently to respond if it ever happens. This is not a substitute for professional medical advice, and any concerning symptoms should always be evaluated by a qualified medical professional as soon as possible. If this video helped you understand something important today, make sure to subscribe to the channel so you never miss information that could one day help protect you or someone you love.